expertise now of persons who are medically involved in dealing with substance abuse. On my immediate right is Dr. Carlos Chase, psychiatrist at the Psychiatric Hospital here in Barbados, Dr. Sharon Harvey, who also is a psychiatrist in private practice and also a lecturer at UWI, and Miss Diana Tucker, a clinician and coordinator. And for those of you who, like me, had to ask what a clinician is, therapy and counseling. So this is now a more hands-on and medical side that we will be focusing on. And Dr. Chase, if you could share your experiences with us, please.
Right. My name is actually Ronald Chase.
I do beg your pardon.
Yeah. Just for clarification.
Yes.
I'm one of the doctors at the psychiatric hospital. I am attached to the forensic unit and the drug rehabilitation unit at the psychiatric hospital. We deal with acute admissions mainly, and there are some chronic patients there as well. Persons referred from the court, persons who walk in seeking drug rehab, persons brought from by their relatives seeking drug rehab. The psychiatric hospital acts as the public hub for drug rehabilitation in Barbados. So if you want to access care free, you have to come through the psychiatric hospital, be evaluated by our drug therapist, and referred to the appropriate treatment facility, whether it would be an outpatient program, one which we have at the psychiatric hospital called the day program or the walk-in program, or a residential program, which at this moment the only residential center is Verdon House for the men, Marina House for the females. All right.
Dr. Harvey, could you please explain to us whether you have any expertise in relation to dealing with drug abuse in the private context?
Right. Well, just to give a bit of background, because I did a year sort of fellowship in my course of training in substance abuse treatment when I was training in England, so I had an interest in that. And then when I came back to Barbados, I was then eventually deputy chair of the National Council on Substance Abuse. So we're all in the same grouping here. And then I worked initially at the psychiatric hospital when there was a fledgling substance abuse sort of treatment center there as well. That was back in the early 90s. So my interest in that has continued, and even in private practice now, I still see persons who come with various difficulties of addiction, including marijuana addiction or cocaine addiction. Some persons come because they want to have some help. Others, of course, are brought by families or friends, not always willingly. But at least, yeah, persons do come even in the private sector. And sometimes it's possible to do the treatment interventions in that setting. Others may be referred to the psychiatric hospital initially, and also to Verdon House over the many years that Verdon has been there.
Thank you. Now, Ms. Tucker, Marina House, this is the female wing of the Substance Abuse Foundation, that's correct?
Yes, it is.
And again, you will be dealing with persons who have come voluntarily, since you are a private organization?
Well, actually, we are a charity, and our persons some come voluntarily, but others come from the courts or referred from the courts. And as Dr. Chase would have said, they are referred first to the psychiatric hospital for detox and stabilization before they come up to residential. And why stabilization and detox is so when a person is getting off the drugs, that is when you can see psychosis. They can become psychotic, or other forms of mental illness will emerge, such as if they're bipolar, then that will show up once they're detoxing from the substances. So
you're-
we're grateful to the psychiatric hospital because we don't have a detox at present. And so we're grateful that that takes place there.
Detoxification is necessary before treatment is the first step in any rehabilitative program. Reason being, you have to first, for lack of a better term, flush the drugs out your system, because usually a lot of clients come either come voluntarily or brought after they just finished using, so they're still, I would say, under the fog of the drug, and sometimes their decision to come is maybe influenced by the court or by a relative putting them out of the home, various reasons, but they come, they're under the fog. You need to first allow them time for that substance to wean off of their body, out of their mind, so they can go through any withdrawal symptoms or syndromes that may, as a result of the drug. Marijuana has a very subtle withdrawal syndrome. Persons don't usually recognize it because it's not like alcohol that persons shake and tremor and get seizures. But there is a great irritability. There's a lot of irritability in persons who abuse or misuse marijuana. And they become very irritable, so they're prone sometimes to get into a lot of arguments, a lot of fights. And yes, you do see some psychosis sometimes that may have been a result of the use of the drug. We call it marijuana-induced psychosis. Or it would have precipitated a relapse of a pre-existing condition, whether it be a psychotic disorder or a mood disorder such as bipolar or depression. And if the person has an underlying disorder on top of an underlying mental health disorder on top of a substance use disorder, we refer to that as having a dual diagnosis or comorbid diagnoses. Those persons, detox is even more crucial, because you have to not only allow the time for the drug to wear off and to come out of the system, but also manage any of those symptoms that may have been triggered as a result of the use of that drug.
Okay. Now that we have a more scientific panel with us, I want to have a discourse on what is the hot topic at the time, and that is the medical use of marijuana. What are your views on the possible use of marijuana under the direction of medical personnel? And I throw it out to all of you.
Well, yes, that's because medical marijuana covers sort of a wide range of possibilities. And I think to tease out the various aspects, it's to remember that the bit of the marijuana, that one of the chemicals that we're concerned about when we think about substance abuse and the treatment of that would be the THC, the tetrahydro
Cannabinoids.
cannabinoids, yes.
Tongue twister.
Yes, THC is easier. And so when some persons are saying they're using medical marijuana, they're still using the marijuana with the THC on board. I mean, what the research is showing, that there are other chemicals in the marijuana plant that can actually be useful. If you remove the THC, there's one that's been found especially useful is one called CHB, and I won't even, or CBD, and I won't even attempt to pronounce that one. But it's been found to be helpful possibly with pain reduction and the treatment of epilepsy, as well as paradoxically it may help with persons who have addiction to opioids especially. So if we can sort of separate out some of these other chemicals that may be quite useful, then that's fine. It's the same thing as using sort of any other medication. But it's important not to have the THC tacked on there as well. And some of what's called medical marijuana still has the THC on board. So we really need to get that separated.
The components within a marijuana plant, there are over 140 compounds that they've discovered so far. And I say so far because they're still researching it. The lead or the lead country or the mecca for medical marijuana research is in Israel. They've received a lot of funding from their government in terms of that. But it is not the first time that medicine has been derived from a plant. Most medication is derived from a plant. The issue is controlling the psychoactive component is present in marijuana. People use medical marijuana and say, oh, well, yeah, we can smoke some weed and we can get our glaucoma treated, pain relief. But it isn't just that. One, you have a form, medical marijuana is a very specific term. There's a lot of testing on it, yes, but a lot of the marijuana that's used for medical purposes actually have been bred down to have very low content of THC. So less than 1%, less than 1.5, less than 0.5% in THC content. And not like what we would see now on the market of 15, 20, 36 and above. Yes, they've said that THC along with CBD, they have medical effects in terms of pain, inflammation. They use them in HIV as well, patients to help with the appetite, and with chemotherapy, persons undergoing chemotherapy with the nausea and the vomiting, they use that as well. But the issue with the medical marijuana is that there's so many compounds in a plant. In that plant, it is difficult to isolate any particular, at any one time, a particular compound to treat a particular illness at a particular dose. And that is the challenge that is being done with medical marijuana, the challenge they have with medical marijuana. The other challenge is making sure that each time you use this medical marijuana, that you're getting the same dosage that you used before. And that is a trouble because the plant, the amount of compounds in that plant depends heavily on where the plant is grown. So the different percentages and quantities of those 140 compounds in one marijuana plant will vary depending on where that plant is grown. In Barbados, in Trinidad, Jamaica, Vincent and Vincent. And even the users know that because the users will tell you, yeah, I like Vinci, I like Jamtown. Right? But it is very difficult to control. But when we use this term medical marijuana, and then people hear, oh, marijuana is used for medical purposes. Oh, yeah, man, I can go and roll a joint and smoke it. It is actually a more refined process. Where the FDA, the Food and Drug Association, has approved, or they haven't particularly approved any particular substance, what should I say, any medical marijuana for any particular treatment of any disorder or disease. And that is because there isn't enough, at this point, clinical research to prove its safety and its effectiveness in delivery of that drug to that person. Because they're going to say, okay, well, you have seizures or you're having pain, smoke a spliff. But when you smoke, you burn this spliff. You are burning a plant. Just like tobacco, just like any plant in your backyard, is a carbon-based organism. You will leave ash, you will leave tar, you will leave cancer-causing agents and deposit them in your lungs. So I am treating my asthma with smoking marijuana, and I'm predisposing myself to lung cancer.
Much like pretty much any other drug, which would have a whole long line of contraindications.
Yes.
Yes.
So they're now trying to work on, especially Israel, the centers in Israel, they're trying to work on a platform of delivery. Right now, one of the more common ones is vaporization. They isolate or they extract out the CBD and the THC in oils. They heat the oil to make it cause a vapor and capture that vapor, and then they fall back into a liquid. And therefore, what you get is that you get like a vapor chamber, a mask, and the vapor of the CBD and THC is given to you in that form rather than lighting up a spliff.
Okay, So there is some positive use for THC after all.
There is. I mean, it is a plant, and as I said, most medication that exists, traditional medication, their derivative came from plants. It is not a new concept, but when we're speaking about marijuana, there's a lot of caution with it. But one of the difficulties and the caution is the amount of chemicals that is in marijuana and the psychoactive effect that we've seen with marijuana, and how these compounds interact in this plant. Not just one alone treats a disorder. So it's to get and to find that combination of compounds in this plant for particular disorders.
Ms. Tucker,
Very
I'm
well said.
curious. I am curious as to the impact that all that we have been discussing has on the female anatomy. Now, I know that Marina House, radio station, is for women, and we speak about the stumbling drunks, and we speak about the impact of marijuana on a person. Is it any different what you are seeing in the females?
It is not that much different in the females, as Dr. Chase would have said. Irritability, the withdrawal symptoms from marijuana, causes the client to present with irritability, easily frustrated, low tolerance. And so at the center, we may find that the women argue a lot, or they are very, very aggravated and not willing to perform certain chores that they're given. So it takes us at least the first month to help one female client to relax sufficient enough to where we can begin to actually teach the coping skills that is needed for them to recover. Something that they go through during that period is called post-acute withdrawal, and that shows up about 60 days or so after they're there. It doesn't happen all the time, but for some it can, and so we have to be mindful of that.
Yeah, it's very, when that occurs, it can be very disruptive to treatment. Because, well, as psychiatric hospital is a referral center, we obviously offer continual services. So if there's an issue, clients come back down for us to evaluate and to co-manage with our partners at the Substance Abuse Foundation. And sometimes that becomes an issue, that 60-day, that month, between, let me say, 4 weeks and 6 weeks, that they really get even more irritable, more picky with themselves, with others. And then that causes incidents, which sometimes I think even on the men's side cause them to have to be prematurely discharged, because it sometimes become very violent. But because people say, oh, well, marijuana ain't a drug, man, you don't get no withdrawal symptoms because people don't shake. But the withdrawal symptoms, and I say it again, with marijuana is very subtle, and irritability, the restlessness is a problem. You will find that they will complain about a lot of physical ailments. Nothing may be physically wrong with them, but because they complain, you have to make sure nothing is physically wrong with them. But they complain of a lot of physical ailments, particularly stomach pain, abdominal pain. Some ladies, before they went up there, marveled at the reappearance of their menstrual cycle, of their menses, because the chronic use of these drugs disrupt our endocrine function. And once you disrupt one part of the endocrine function, you disrupt the homeostasis of the body. And these days, they're saying that they're endogenous or in the body, they're natural CBD compounds that are secreted in our brain and latch on to the respective receptors that helps with homeostasis in our body. And the endocrine system is very linked into the homeostasis of the body. And when you start to put in exogenous substances into the brain, you offset that homeostasis. And therefore you get a myriad of possible issues. But I think, to follow on, the issue that I think we face is that a lot of persons don't recognize that post-acute withdrawal, and it can be very, very problematic.
Yeah, I want to come back to the sort of female aspect of things a bit, because one effect that we have to take note of is the effect on the fetus if a woman is pregnant and using cannabis, because as Dr. Chase was saying, we know that it attaches to the brain, and that we have sort of natural occurring cannabinoids that help with brain maturation. But what can happen with a female who's pregnant and using is that it interferes with the maturation of the unborn baby's head, brain, so that then that baby is born with a variety of problems in terms of slow development and sort of not being able to concentrate and focus and sort of behavioral issues, which was none of their doing. So that we have to be aware of that. And now that there's more use of marijuana in the States, as it's sort of been legalized and decriminalized, they are now finding that there are more miscarriages among persons around females who are using cannabis, and more concerns about the effect on the babies
Is this
as well.
is this similar to the effect that smoking tobacco has on fetuses?
Well, it's more marked. I mean, certainly smoking using alcohol. I mean, alcohol also causes quite severe effects on the fetus.
Disturbances.
Yes. And often with persons who are smoking, they may not, their nutritional aspects may not be adequate, and so there's an overall effect on the fetus. But because of these attachment of these cannabinoids to the brain of the fetus, there seems to be a specific effect there, which is also, I mean, another stage of life when the brain is growing is through adolescence into adulthood. And of course, it has an effect there as well. In persons have poor judgment and sort of delayed maturation, and they actually can fall a few IQ points as a result of smoking cannabis.
During that period.
During that period.
During that adolescent period.
Right. But what's of concern is that in all cases they don't sort of gain it back if they stop using the cannabis. So it may be almost a permanent effect in terms of reduction in IQ. And often that's the stage when persons are coming out of school, going into university, and often there's an association with university life and smoking as well, just at the time when you really need your brain to be working well. It's not working well, and it can affect judgment.
Is that in any way, again, I just want to make a comparison with those drugs that are legalized and those that are not legalized, and are there similar effects that are seen with the use of the legal drugs as with the marijuana?
Any substance which you may, for example, during pregnancy, there are a lot of drugs and a lot of things you shouldn't use and take, legal or illegal, because they will have an ultimate effect on the fetus. Marijuana is just one of those. But marijuana, because of its primary actions in the brain, there's a concern with not necessarily organ abnormalities of the heart or of the lungs not maturing properly in the womb, but in terms of that individual's cognitive function, that individual's intellectual function as they get older. And that is an area that they're still researching to find the exact impact and to measure it. There have been studies done comparing performance of school-aged children who live in prohibited states where marijuana is prohibited and those that live in legalized states. And what they found is that the persons who live, the individuals, the children who live in legalized states of marijuana, they actually achieve less. Some of them, they have an increased rate of dropout from high school. They have an increased rate of not actually, they're less likely, I should say, to go to college. Whether or not that is associated with what the other panel discussed or mentioned, a motivational syndrome, is still under discussion. So yet again, you see that marijuana is a drug. There are many drugs, legal and illegal. They have different effects. But the effects of marijuana are sometimes subtle, that you don't, or they present in a different way than some of the other drugs. So then you don't really associate the two, or therefore you don't see the true impact. In adolescence, where you have a poor judgment, where the brain is still maturing, when you use that marijuana in that period, it is hard to gauge where that child would have gone if they had not used marijuana. Right? So you have to what you gauge, what they have been gauging is performance when they're using and their performance years before their use. Right? There's also evidence from the 1980s of persons who use marijuana in adolescence being predisposed or at higher risk of developing schizophrenia in adulthood. But yet again, no one will particularly easily link on face value you developing schizophrenia in your 20s and smoking pot in your teenage years at 13. But there's a link. It is not always, because the temporal relations to some of these things are longer. It isn't always seen, but they're there.
So is there any body of research to which we can refer in relation to finding out what these additional, and again, because we're speaking about decriminalizing or legalizing, in your wrap-up, could you give us a guideline as to where we could look next for the information?
Well, there have been some studies and comparative studies done in Europe, particularly in Amsterdam and California, and comparing the two, and they've found that there isn't really increasing usage, but the perception by the children and adolescents on the perceived harm of marijuana is less. They don't think it is harmful, and they're more likely to use and engage in marijuana use as a result of it.
Dr. Harvey, are there any parting words for us?
Okay, well, in terms of where you can sort of point to get information, I find a useful place is the National Institute on Drug Abuse in the States. NIDA.org has some nice sort of succinct drug facts that are that's quite helpful. And just another quick thing about the effects of using cannabis in our sort of daily life. Another bit of research found there was an increase in car accidents in states that legalize marijuana. And we have enough of them. We don't need any more.
Ms. Tucker, is there any research being compiled in relation to the ladies under your care?
Well, not at this present time, but what I want to say is that treatment works. And we have managed in the 2 years that we've been open, we have about 10 ladies that are currently employed, that have successfully completed courses and received certificates in nursing, or housekeeping, cookery, and so treatment works. Once we can get the ladies to settle down and settle in and accept that, yes, I have an addiction. I have something going on with me and that made my life unmanageable. And now I have this opportunity here. I'm going to make the most of it. Once we can get them to see that, then we have success.
I want to thank all of you for joining us. Certainly, we extend our thanks to our panel, Ms. Tucker, Dr. Chase, and I will not call you by the wrong name again, and Dr. Harvey. Thank you very much for sharing your expertise and your knowledge with us.